We launched in 2019, and we were quickly embraced by the community and by hospital partners and expanded rapidly with our forensic nursing program and in contracting with different hospital facilities just because we made that service so easily accessible for them. Within the first 3 or 4 years of us launching, we had over 70 hospital partners. In 2023, we launched 2 satellite programs. We cover over 15 hospitals in the Rio Grande Valley. We have a second satellite program in the North Texas region and currently are covering 7 counties.
We have 10 full-time forensic nurses in the Houston area, 5 for our Rio Grande Valley location, and 5 for our North Texas location. They're experts in the field because they are doing this work day in and day out. They're all full-time. Our nurses in the Houston area specifically, we go all the way from Huntsville down to Lake Jackson, Wharton, all over to mainland. So we cover a really large geographical area. We're able to serve in so many different locations because we have really perfected our mobile services. We work off of delegated orders from our medical direction, and that allows us to really go into any facility. So we can contract with different hospitals, different clinics, and we are even able to go into different environments like nursing homes and juvenile detention centers.
The goal of the Forensic Center is to provide a safe place for them to come to and get seen and get treatment and get resources within the community.
A forensic nurse can take care of a patient that has been a victim of multiple types of crimes, so maybe trafficking or child abuse, elder abuse, sexual assault, obviously, that's what we're most commonly interacting with, but also domestic violence, even suspects. So when we think about the bigger scope of forensic nursing, SANE nursing just falls into one of those spaces.
Forensic nursing has grown a lot over the last 3 to 5 years. A lot of it is because we're seeing the changes over time of what patients are needing and what victims are needing. And then we're also seeing the benefits related to forensic exams and advocacy and forensic interviews. So we're seeing better outcomes in court processes, and then we're seeing better outcomes for our patients in their mental health and the way that they recover and moving from that station of being a victim into being a survivor.
We do collaborate with a bunch of different people. You know, we have the forensic investigators that do their part. We have law enforcement that does their part. We have the forensic nurses, which is us, that we do our part. We have advocates that reach out. You know, we have all these different aspects that all have to work together, and we all have to communicate to really get a full case and to really get a full story for these patients.
Well, after we get done with our medical forensic exam, we would have an advocate on staff hold out their hand and say, hey, let me help guide you to the next step, whether it's food and shelter or counseling. Otherwise, victims are kind of left there to figure out the system on their own.
We're able to assist them with getting to that medical portion by providing them with safe transportation. We're able to connect them to resources in the community that will assist them with shelter, and then can facilitate that healing process afterwards.
The service we provide helps that survivor continue to heal, to grow, to feel supported, to be heard and validated, so that they can move their lives truly forward.
This is a judgment-free zone. It's going to be comfortable, and they're going to be talking to people who are there to help them. And we're here as that supportive person that will be with them, not just here, but even afterwards.
So something very unique about the Forensic Center is we created the Adult Forensic Interviewing Program. And that began in June of 2020, and it offers a safe place for victims of violence and witnesses to crime to come in and share what happened. And it's done by trauma-informed interviewers who have experience working with victims of violence.
We provide a neutral and safe space for adult victims to come in for an interview. These interviews are recorded, and they are done in collaboration of law enforcement in a neutral and safe space where the participants or the adult victims have the opportunity to share everything that has happened in their own words.
When an initial crime happens, they don't have a lot of autonomy on typically even what happens next and really a lot of the process. So when they come here, then they're allowed to exercise their own agency in how the interview goes.
It's also important for the interview to be done in a way that is legally defensible, so that in their minds, as they're going through the interview, they know if all those boxes have been checked. Because really the idea behind a forensic interview is that it is a full and complete interview, and we don't have to keep asking people these questions over and over again.
It's really hard for victims to come forward, and so when they do come forward, we really want to nurture that, and that we're doing something for them, hopefully trying to take that power back that they may have felt that they lost.
The mission here is to make sure that victims are met where they're at, so that they are not having to go 100 places to try and find the resources that should be readily available, and continue to connect them with other hands down the line instead of falling off somewhere in the middle.
Even 10 years ago, there was 8 facilities in Houston and surrounding areas that you could go to for an exam. 8, and they had gone to the wrong place and the wrong place and the wrong place, and they kept trying again. And I can't imagine what that would feel like, to be turned away and told to go somewhere else and have to show up to the next emergency room and tell your story again, and then told, oh, we don't do that here, you're gonna have to go somewhere else. And I really, truthfully, I just really wanted to make that better.
We can create that space for the patient. To kind of give them somewhere to go, to just let loose, let it out, cry if they want to. We're here. And we're all human, so we're here to just take care of each other.
I don't necessarily see it as difficult. I think when you have that patient who you can see their spirit change from the moment you walk in the room to the moment you leave the room. They say thank you, they smile, they want to give you a hug. Just the gratitude that you can feel from them.
My hope for people that I see is that they know that they are more than this situation, that they are still a whole and complete person, that they are cared for, and that they have an army of people behind them and beside them that want to see them recover, that want to see them win, and that want to see them get justice, however that looks like to them.